At this time, I'd like to introduce our Director of Plum EMS, Brian Maloney.
Thank you very much. I appreciate the opportunity to be in here. Plum EMS, and with this current state, with what's going on, we've been actually preparing over the past couple of weeks, making sure that we're stocked with equipment that we need to safely respond to any flu-like dispatches or suspected COVID-19. We've been doing a lot of training in the station, a lot of research, making sure our SOGs are updated, and that we are going to be ready to respond to any type of incident within the community. And with that being said, we want everyone to know that if they call with flu-like symptoms, to expect us when we show up. We'll be a couple minutes outside the house getting geared up. We're going to be walking into the house with gowns, with masks, with head covers, double gloved. And when we go in the house as well, not to be offended if we stand back 6 to 10 feet to initiate our assessment and to start talking to the people. All this is recommendations by the CDC in which we're following to make sure we take care of ourselves, minimize exposure. And there might only be one person take the primary lead while our second crew member is staying back further. Once again, to help minimize exposure. This isn't to offend anybody or upset anybody or treat anybody with less care. It's just to make sure we take care of folks. And then one of the first things we're going to do as we walk into a house as well is give the patient a surgical mask to put on. Once again, try to help keep things contained. So we do our best to make sure that we cover all our bases with that. The other thing that we're going to do is that if someone's presenting with flu-like symptoms, unless we see a life-threatening circumstance or emergency, we're going to ask, did they call their doctor? Did they utilize resources from maybe their healthcare center, such as the UPMC or AHN, because they have resources which they can call to do follow-ups to find out if it's recommended that they go to the emergency department. Because the last thing we want to do is overtax our hospital system. Right. And that's one of the biggest concerns, is that they're going to run out of beds, they're going to be able to run out of equipment or supplies. And so we're really going to encourage folks, and not to downplay their circumstance or the fact that they are sick, but do they truly need to go to the emergency department, or is this something that they can follow up with their doctor? Because a lot of doctors, he or she's going to tell them fluids, Tylenol or Motrin, and just wait it out, unless there's a life-threatening emergency such as shortness of breath, or if we walk in and we find things unstable.
It seems like a lot of the discussion in the media has to deal with this concern of overwhelming the hospital's capacity for taking care of individuals in the event that they're affected with the virus. And they've kind of referred to this as flattening the curb in order to make sure that we don't run into this issue. How is the Plum EMS prepared to potentially deal with a number of individuals within the local community who may be impacted, and what resources do you guys have to assist you in accommodating the volume that could potentially take place in the event that you have to transport people to hospitals and things of that nature?
All right. In a case that we have a surge of requests needing transport to the hospital, is that we're prepared to add additional staff, so we can staff anywhere from 3 to 4 trucks just within Plum ourselves. We also have mutual aid agreements with our neighboring communities, that if all of the Plum trucks are out, that we can have a neighboring service come in and offer assistance and act as our mutual aid. We've been in touch with all our neighboring services as well, making sure that they're equipped well, and we're also making plans that in the event that some of our staff members have to become quarantined because of maybe possible exposure, we're going to be working with neighboring services to make sure that we can still provide emergency medical service to the community and even surrounding communities. So we're developing plans. The Allegheny Emergency Service as well has been stepping up, helping us obtain N95 masks, which that's good for healthcare providers, especially if we're doing some type of advanced airway or some type of aerosol treatment that creates those droplets, because that's the biggest way that this is spread. And so I can't speak highly enough about the Allegheny Emergency Services, and even Allegheny County 911, their emergency operating center. If you call 911, they're going to ask specific questions, such as if there's any flu-like symptoms, fever, cough, something that's been going on, and they notify us. So that's how a lot of times when we show up at a house, we're going to spend the first 5 to 10 minutes just getting properly prepared. So it's a multi-agency approach to this, but the big thing that we're asking folks is, make sure you follow up with your doctor, with one of the healthcare, to find out, is this something truly needed to go to the hospital? We're also working with all our local hospitals and preparing that if there is that surge, if there is that overwhelming need, we're willing to work with them and help them as well. And they said the same thing for us. Everybody is working together to try to help make sure everybody's taken care of.
That's great. Now, one of the things that I'm most concerned about are our seniors. Mm-hmm. And we keep hearing that our seniors are the most susceptible segment of the population for this virus. And we've been called upon to engage in social distancing. Mm-hmm. What kind of recommendations do you have for our seniors who need to go out and get, say, the bare necessities from the grocery store, but are afraid that they might now be introducing themselves into a large population that makes them at higher risk for potentially, contracting the virus?
I would say that actually the community is one of the best resources. Find out what's here. I know we had representatives from the senior center or community center. Find out what is available. If you're a resident at one of the retirement communities, talk to folks. Find out if you can have your groceries delivered. Find out what are those potential opportunities. It's meant to try to really minimize the interaction of people, especially in larger groups. If they feel the need, see if they can, get a surgical mask, to wear to help protect themselves the best that they can, and really working with the community. And what you're hosting right here is one of the best things. They can hear this information, because I don't know all the answers. Right. But what you're doing right now is getting it. And so this right here is one of the best things for them to sit there and, I can do this. I can call this person. I can call this group. So that's a good approach that you're actually taking right here. So this is one of the best things. I like it. Great.
Well, thank you so much for joining us today, Brian. We really appreciate all that you do for the community, and stay safe while you're out there.
We will. Thank you very much. I appreciate the opportunity to be here.